Hi, and welcome to another video from the CTAD Clinic. My name is Dr. MikeLloyd and I'm the director of the clinic. Today I'm going to be discussing about treatment for complex trauma and dissociation, specifically looking at the dissociative disorders. This will encompass dissociative identity disorder, other specified dissociative disorders, depersonalisation, derealisation, amnesia and conversion symptoms. There are many variants of therapy for dissociative disorders, conditions, and largely as this is an unregulated field, so there are no specific examinations or qualifications that people need to have in order to be able to practice treatments for dissociation. We rely much more that people are working within the field of competency, that they have the correct access to training, updates, CPD strategies and supervision. Some of these strategies that people use will be short-term and some will be long-term. Realistically, there isn't a completely right or wrong way to do this. As we'll see when we go through this discussion, is that the individual is paramount within this. So any treatment needs to be targeted and focused at the needs and the abilities and the tolerance levels of the individual. So therefore, any specific guidelines that I discuss are to be used within the principles of clinical judgment. What that means is that any therapist that's practicing treatments for dissociation needs to be aware of guidelines and how to use them appropriately within the context of the therapy room. Some of the short-term strategies, for example within the UK, within the NHS, it may be that people are only able to access a short-term amount of work, maybe 12 sessions, maybe 16 sessions. The focus is likely to be more on skills building rather than like a full-term treatment as such. The longer-term strategies are more likely to be working towards achieving a sense of recovery for the individual. The main guidelines that I work from are those set out by the International Society for the Study of Trauma and Dissociation based in the United States, also known as the ISSTD. They've produced two sets of guidelines, one for adults and one for children and adolescents. These guidelines are available from the ISSTD website and I'll leave a link to that. The guidelines are also in English and French and they are free to access. They were originally developed in 2005 and then revised in 2011, and they are a consensus of the best literature available about how to treat complex trauma and dissociation, specifically the more complicated variants of dissociation such as DID and OSDD. Remember again, the guidelines are not a replacement for clinical judgment. They are not to be used simply as a set of rules to be followed. They are a guideline for how to work therapeutically. Clinical judgment always must be applied. What's really nice about the guidelines is that they help the reader understand how to incorporate other methodologies. So things like CBT, cognitive behavioural therapy, DBT, EMDR, CAT, compassion-focused therapies, physical therapies, they're all built into these guidelines. The guidelines are not a methodology, they are an approach to treatment. So they discuss many ways in which different therapists can help people achieve recovery using the tools at their disposal. It's not about replacing those methodologies with something else, it's more of a philosophy of how to approach the individual and be able to work with and manage the dissociation that they're experiencing. The principles on which the guidelines are set out is that of structural dissociation, and they follow the lead of many other esteemed researchers and clinicians in the field. People like Janina Fisher, Judith Herman, Peter Levine. These people are all relevant within the context of this methodology. So the guidelines really come together and they bring in all of the experience of people around the world for how to go about this in the best possible way, and there are many pieces of research being done to look at the effectiveness of these treatments. People like Bethany Brand, for example, are leading the way in helping us understand that these are safe and effective treatments. I've published some evidence about how they can be cost effective, and all of these are worth looking at to try and understand why these guidelines are useful to us. The basis of the guidelines is what's known as a three-phase treatment model. So the way that treatment is approached for people with these levels of dissociation is in three stages. The first being stabilization, and this encompasses things like communication, the hierarchy, the nature of the system, coping skills, what symptoms are being experienced, boundaries, and the awareness of the system. The second stage is the trauma stage. So it's about the understanding and the exploration of traumatic memory and the impact of this upon the individual. Whether amnesia is present for those memories or not, it's the understanding of what the consequence of these memories are for the person, to be able to process and work through the experiences that have been had. Generally early on in life if we're dealing with DID and OSSDD. Third phase is that of integration. This is integration of thoughts, of feelings, of actions. I also like to think it's integration into the world, into life, because many people with dissociation are very isolated, and if the dissociation is able to be overcome, the person then has to re-engage with the world. The thing about the integration is that that can be really scary for folks. They may approach this or be feeling like the therapist is saying to them, there can only be one person at the end of this. So whatever your internal system, parts, alters or others, they'll be gone by the end of the journey and it'll just be you left behind. This is not necessarily correct. Back to the individual principle, that everybody has a right to determine what their goals of recovery actually are. In my experience, many people arrive at therapy wanting to get rid of all the parts, and they say it in those terms. By the end of therapy, many are saying, actually, I want to keep people. I don't want to lose this internal world, this family, this friendship, this network that has been built up over many years. And it can be a painful journey for people to go on, and they want to keep hold of what they've got. People should be allowed to be flexible and change their mind. Therapists should not railroad people into making decisions about what their end stage is going to look like. I doubt many do. It's important to know that the individual should have a great deal of control over what it is that they want to achieve through therapy. And that integration stage is enormously important in what a person is aiming towards, or what is it that they want to try and achieve through therapy. This is not necessarily a linear phase, so it's not like the people within therapy, like they do stabilization and then the trauma work and then the integration and then they're out. There's a lot of to and fro. So what can happen a great deal is that a person leaves the stabilization phase for a while, so they've done a lot of stabilization, they feel well grounded, they feel resilient, they feel strong and confident. They approach traumatic memory and suddenly they become destabilized. So we move back into the stabilization, we rebuild, we think things through, we be creative, and they go back into the trauma exploration phase. For lots of people, the trauma phase is often the least important. Going through stabilization, many people don't want to address the trauma. They don't really want to go back and have a reliving or a re-experiencing, or to have all of that stuff come back into their consciousness. They actually just want to get on with life. So there can be a little bit of a leapfrog that can take place at times. It's not correct that no matter what, trauma work has to be done. It does not have to be done in that sort of like really procedural way. The individual principle again applies. What people want, what they can tolerate, are enormously important. One resource that might be particularly helpful is a DVD that was produced with first person plural called No Two Paths the Same. And this video really is an educational look at the guidelines. It's a way of being able to understand what goes on in the therapy setting. And I would very much encourage you to download this from the First Person Plural website if you're really looking to get an in-depth understanding of this, as well as reading through the guidelines and obviously knowing what they entail. The three-phase treatment model is not without critique. It's not that it's been put out there and every single person agrees with it. There are people who criticize the model, who don't think it necessarily applies in the best way, and that it takes too long, and that there is too much of a delay before moving towards the trauma work. So some of the critiques of this have been really well written about within the Blue Knot Foundation Guidelines, which is an Australian foundation which has looked at all of these treatment guidelines available and synthesized them together into this amazing set of guidelines. Well worth reading, and the critique of that is very good, because what it seeks to address is that difference between the complex post-traumatic stress and what would be known as the simple post-traumatic stress. So the degree to which we approach trauma work quickly. So many critiques of the three-phase model say it takes too long to address this stabilization when you are not really approaching the trauma. If dissociation is built from trauma, why do we not head towards the trauma straight away? So this is what's called the exposure therapies, that if you approach the trauma, if you approach the exposure to the symptoms and the triggers of that trauma, the person will start gaining confidence and be feeling better. There's absolutely nothing wrong with that. It just doesn't always apply within dissociation, because when exposure happens, people then can start dissociating very, very quickly. It's well worth looking at the Blue Knot Foundation guidelines to really understand what this model is coming from, and especially to know what your therapist, if you are looking for therapy, is advocating, because it has to take in the tolerance into account. So the ability of the person to be able to withstand that exposure is absolutely vital in how to implement any set of guidelines. I feel personally in my clinical practice that caution is a useful construct to hold. So when applying these three-phase treatment guidelines, it's understanding the person's stabilization skills before moving forward. Some people are very stabilized, some people really aren't, and the amount of time spent in the stabilization phase is an individual amount of time. Everything is geared and focused towards what that individual can take on within therapy. There you have it then. Therapists may apply things very, very differently. They may bring their own methodologies into account. I think what is useful is that there is an understanding that there are treatment guidelines available. Within the UK, we look towards the American and the Australian versions because we don't have a set specifically for this within the NHS system. That's something that we're working on trying to change. For the time being, those guidelines are the best that we've got, and I think they are actually extremely good. Always worth reading guidelines with a hint of caution and a little bit of a critique in mind. Evaluate the information, think about how it applies to the individual and what they can tolerate, and work in partnership with the individual. So regardless of what set of guidelines are being used, whether it's this model or whether it's a different one, is to be able to discuss how these apply within the therapeutic setting. So bring the therapist and the client together in the room as a partnership, working through these things, reviewing, reflecting and altering what is done and what approaches are taking as things are either working or not working. I very much hope this has been a useful video for you. There will be some links to some of the things mentioned at the end, and I'll put those into the text of the CTAD channel. Please leave any comments as before, and thank you again for people that are asking for these videos. Again, this one came through as a result of specific requests received. Please like and subscribe if you want to continue following the CTAD channel for content, and take care of yourselves. Thank you.